I do think that this has the potential to really dramatically change the landscape, as using your words there, because um, I think we have always known in the allergy field that epinephrine works. Epinephrine is able to stop allergic reactions, prevent anaphylaxis, and keep people safe. But we've also run into many situations where epinephrine is not administered, and for many reasons. But one of the biggest ones being just a fear and an anxiety around the injection aspect of it. To now have a non-injection option available to us, in addition to, of course, the injections that will always be there as well, I do think that is going to really, again, have more people using the medicine at the right time to really keep themselves safe. Yeah, so when thinking about allergic reactions, we have definitely seen that the earlier you are able to get in there with a treatment, the more likely you are able to stop that treatment, stop that reaction from becoming anything more severe. And again, going back to the idea of the injections, we've had many stories where folks are thinking about it, holding on to the EpiPen, thinking, should I use it, should I not? And those kind of delays sometimes can lead to bigger reactions. And so hopefully a non-injection form of this folks will be much more willing and open to use, not only use it, but again, use it early on in a reaction to prevent these reactions from becoming more. I do think, in addition to sort of a willingness to use it, I think there's equally important folks need to carry it with them. And so to that point, to have a sort of a device that is easier to hold. So as far as the form factor being smaller, I think it's important and also able to withstand, exactly as you mentioned, different temperatures in different situations. Because again, I can see folks where it's, your food allergy doesn't sort of go away when you go to that soccer match or when you go to the beach or different scenarios that you might be in, the allergy and that risk may still be there. And so to be able to have a device that's easier to carry and can withstand different environments is going to be important to ensuring that people are carrying that epinephrine wherever they are. Yeah, I think it's both. It's good and some wariness, appropriately so. So I think on the one hand, again, most allergists, if not all allergists out there, have had those experiences of folks where they probably could have or should have used epinephrine and perhaps did not. And so I think those are experiences and stories that we have heard that definitely um, showcase the importance of a non-injectable version. At the same time, this is all we've known. Injectable and epinephrine is all that we've had in the field for as long as all of us have been practicing. And so I do think that there's going to be a trust factor that will be important here as well. And so I do think that we can get there, but in the beginning, it will be a bit of a leap of faith, I think, for a lot of our folks because we have been so used to sort of the injectable form. So these early days will be important for all of us to sort of learn together with our patients and with other providers sort of the best uses of this and some of the nuances of how we can administer this. Yeah, so I think early on, definitely having an open discussion with our patients to explain sort of what we know about the medication, but also what we may not know just yet, until we get that experience under our belt. I do think it's important to keep for all of us to keep in mind that there is a weight limit to it at the moment. And so this is intended for patients that are 30 kilograms and older. And me, myself being a pediatric allergist, a lot of my patients are under that. So at the moment, it's not approved for that. So I think, again, we have to remind ourselves and be aware of that as well. And there is some concern about any patient that may have issues in the nose, whether they've had a history of polyps or surgery or other things, perhaps we don't know, could affect sort of how well the medicine absorbs or not. So there are going to be situations that are going to be ideal for neffy, and there are going to be situations that may not be. And I think those are important things that we need to talk to our patients about. And then as a specialty, really make sure that we are asking the questions and studying this so that we can find the best way to use this medicine moving forward. Yeah, I think it's continuing the conversation we've had of trying to change the narrative around epinephrine. And so I think for many years, probably driven a lot by our own education as allergists, but for many years, the concept of epinephrine has been sort of that only in that most life-threatening situation, the last ditch kind of medicine that you're going to use. And I think we've learned that that should not necessarily be the case. Of course, in this situation, but definitely earlier on, this is a medicine that works very quickly and very effectively. And so when we know that there's an allergic reaction happening, um, this is a medicine that can get in there and work. And so I do think that it's going to be important that we continue to encourage that sort of way of thinking about epinephrine. And this non-injectable version will really help in that because again, there's been, like I mentioned before, concern not only in the patients, but even in the providers, in the idea that, hey, I might have to give this injection. There's an anxiety, there's sort of a wariness that's there. And so hopefully, if we can overcome that, we can really be thinking about sort of when's the right time to use the medication, separate from sort of any of these anxieties or concerns we've had in the past.